Downs and I'm an anaesthetist here at the Prince of Wales Private Hospital. We're making this video today to talk about the importance of anaesthetic timeout, the so-called stop before you block, and the steps that are involved and why we do it. Multiple inadvertent wrong-sided blocks have occurred at different hospitals worldwide. Why does this occur? How does this occur? There are a number of factors, and the most common one is distraction. Distractions are everywhere in the operating theatre, and it's important to focus, especially we all know we're under time pressures, and so keeping a list efficient is important, but taking the moment to do things properly is more important. The third reason why we could make an error is if the site is not marked by the surgeon, or if they've marked the incorrect site. And so it's important to make sure the surgeon's sites are visible and that the surgeon marks the operating site before the block. Another factor in error could be if this important moment of anaesthetic timeout hasn't been done or hasn't been done correctly. And why is it important that we block the correct side? Of course, we don't want the surgery to be cancelled. And so if you block the wrong side, an eye block or a shoulder block, the surgery may need to be cancelled. Or otherwise the surgery may proceed and the patient has a lot of pain post-operatively or some other complication relating to their block. So that's why this is such an important thing and something that we really need to take seriously. And so just to run through the steps, because in a moment my colleague Dr. Upton is going to show you an example of how to do a stop before the block perfectly. And so the steps involve, firstly, the patient, the anaesthetist and the anaesthetic assistant all stopping for a moment, and then taking the moment to check the site, to check the side, to look at the consent, to look at the patient's ID band, and this is all immediately before you're about to start the block, just before you're putting the needle in, checking it at the last moment so you can't be distracted again. Checking the patient's ID and the consent form, checking the surgeon's markings, and preferably, if the patient's not sedated too much, checking with them that you are doing the correct side, and then proceeding safely. It only takes a moment, and all staff and VMOs at the Prince of Wales Private Hospital are expected to comply with this policy.
Hi Casey.
Hi Casey. We're just going to do a quick timeout, and it's basically just a last minute check to make sure that we've got all the right details and we're doing the right procedures. So we're just going to do a bit of talking while we're checking the details.
Okay, so I've got the consent form here, Dr. Upton.
Fantastic. Alright, so just checking their armband here, we've got Casey Jane Beck. The UR is 294588, and the date of birth is the 27th of the 3rd of 1990.
That's great.
Fantastic. We're consented for a left shoulder arthroscopic arthroplasty and rotator cuff repair. The consent is signed and dated and signed by Casey.
That's great. So I've got our anaesthetic timeout form here. Okay. So we've checked the patient date of birth, UR number. Okay. The consent form is fine. Okay. Now the procedure site is the left shoulder.
Yep. And so the left shoulder has been clearly marked.
Okay. Any alerts?
No alerts.
No alerts. And our ASA?
ASA score is 2.
And signed and...
Perfect. Alright, we're going to go and get started now, Casey. Thank you.